my plan today is, number one, I want to tell you what I know already from what I've seen. Number two, hear from you what's been going on, which I already have an idea from Bill. Number three, review the film so that we can see what was going on. And number four, implement the plan of action, which is what we need to do, especially with someone as young and healthy as you are. Josh, how are you?
Hey, I'm doing well. How are you? Good to see you.
Same here. Thank you, and thank you for your patience. I've been in clinic, and I knew when he was coming down to your time, I was like, there's no possible way. I was seeing actually the patients that I need to operate tomorrow, and I knew there were a lot of questions, and I figured that I didn't want to rush.
Oh, okay. Well, I appreciate it.
I'm with you.
Yeah.
So
Well,
thank you for reaching out. And who do I have the pleasure of meeting right next to you? I see part of her face.
Hi, I'm Jackie.
Jackie, how are you?
I'm excellent. I was actually there with Josh when you guys met for the first time
4 years
Mayo
ago.
Clinic. Yeah.
Amazing. You didn't already that low?
yeah. It was this time, I think, for 2017.
Mm-hmm.
Amazing. So that's great, Jackie. Thank you.
Yeah.
And thank you also to Diogo Dr. Garcia for gathering all the films and everything, and then putting us in touch. So my plan today is, number one, I want to tell you what I know already from what I've seen. Number two, hear from you what's been going on, which I already have an idea from Bill. Number three, review the film so that we can see what was going on. And number four, implement the plan of action, which is what we need to do, especially with someone as young and healthy as you are. All right?
All right.
This is what my doctor's telling me. Like you had a seizure, the other day, and I saw you posting about it.
Yeah.
And you've been social media, so I've been tracking you. I've been watching you, so I keep an eye on you. And but also my doctor, what I wasn't aware of social media, that my doctor was telling me that either you run out of medication or somewhere for 2 days you were not taking the Ketra, and then boom, you get one of these.
It was like 50 hours after my final dose Saturday morning, and I was just going to let my dog out, and I got stuck in a stutter saying "let's go," and I kept saying "let's go," and it was like my mind and body separated, and I was like, there was no pain, there was no fear, it just was like observation, and it just kept going and going, and then getting faster and faster, and then all of a sudden I felt like my head doing this, and I started doing circles. My dog thought I was playing with him, and then I blacked out. I woke up, felt nauseous, didn't throw up, but went and sat back on the couch, and then called Jackie.
Amazing.
It was wild.
Unbelievable. So, and then you snap out of it?
Yeah.
By the time you came in, he was already out of it, or what happened?
Yeah. So it happened sometime between 10:35, 10:40, and when I landed at the airport around 10 after 11. He was supposed to come and pick me up, and I called him, and he sounded a little out of it, but not nearly as bad as the first seizure. The first seizure, he was responsive, but he wasn't very verbal with me until like 3 hours later. Like he would nod and he would kind of answer questions for the paramedics, but the confusion and the disorientation was very, very real. And I was asking him on the phone, I was sitting on the plane, and I was like, do you know where I am right now? Do you know where I was last week? And he could answer all the questions. So by the time I got to him 20 minutes later, he was fine. And I have a background in sports medicine, so I did like quick neurological assessment. So his pupils were reactive, and they were equal, and they were doing good. His coordination was a little off when he was standing, but his depth of field was okay. So his depth perception was good. There was no like strength deficits on either side, and he had a little bit of problem with memory. So even like, hey, can you remember these 5 words I say to you? Like he was able to tell me 3 back, and then I repeated again, and he told me all 5. But 20 minutes later, he was like, I couldn't tell you those words again. So
he really, so that's, and remind me again, arm, leg, anything else? With this, any weakness or any, the main speech?
Yeah, it was mainly, and I mean, he wasn't even, his speech wasn't slurring or anything. So it was just a little bit of confusion and a little bit of memory, but by the time I got to him, his grip strength was good. He was able to raise his elbows and hold that, and he was able to do his legs and his hips as well.
And before Jackie's mom came to the house, because they lived 10 minutes away, I had got myself up out of the living room, gone to the bathroom, and then came back out and sat down on the couch and then called her. So I was coherent enough to do all that, but the last time I fell out of it for like 8 hours.
Yeah.
That makes sense. I got you. And tell me something, right now, are you feeling headaches? That's one thing that I usually
No, and that's what's interesting. So 2010 was when we discovered the first tumor. And I was riding X Games, I was backflipping, spinning, all that stuff. So, and based on the size, we don't know how long it had been there. And I'd been having tons of symptoms, but I kept getting written off as here's some pain meds to manage the pain and all that. So for 11 years, I didn't have any seizures, I didn't have anything. And then back in May, still nothing. I was still training. I was lifting heavy, still being active, playing sports, all that stuff. And
I will say though, he had more headaches this year than he normally does. They weren't constant and they weren't frequent enough, but it was to the point where January he was due for an MRI, and anytime he was like, "Oh, my head kind of hurts," I would get anxious, you know. So it was enough that I noticed it because he never gets headaches. He's never sick. So, you know, him getting a headache once a month, I was like noticing that a little bit more.
Yeah. I agree. I get it. You know, they may be related to this because these things, you know, they irritate the dura. Remember, they come from the dura.
Mm-hmm.
You know, and remind me again, were they grade 1? The
I don't think they ever told me. I don't think I was ever told anything other than it was a meningioma.
Yeah, because that's actually a question that I have written down for you. Like, what?
No, I suspect that it was a grade 1, but I don't remember. I was looking at my notes. I don't remember all the details. Do you remember no mention of it? But, you know, the reality is the following. What we're doing nowadays with the lesions, we're beginning to understand them more. Actually, I send them for sequencing nowadays to try to understand what mutations they have and what other things, because you're so young. How old are you right now?
32.
You know, early 32. So you got many years that will ahead of you. So we need to begin to understand how we're going to manage this. So I showed you a scans. You know, I'm going to show them to you right now. So let's go ahead and review them together.
Okay.
All right. So we put them right here. I am going to share the screen, and I have some images right here. When we look, this is December 2017, and these are cuts like this.
Mm-hmm.
Okay.
One by one, you know, from the top to the bottom. You know, as we're looking at this right here, you know, you can see a little bit, some of the small little lesions right here. So you can see the little ones right here. They're between the little veins, and, you know, you clearly have some sort of condition that predisposes you to these little lesions, right? So they're right there, but nothing is irritated. You're doing great. This is 2017, almost 4 years ago. You know, but there's definitely a little bit something going on right here, right next to those little veins right there.
Yeah. And that's where the original one that was taken out was located, right?
Right, that's right. The original was located right there. Look, this is a little darker area.
Yep.
And right there, it looks pretty good, to be honest with you. I don't see much around it, you know. Around it, so you can see some, right? So when I look at this image and I want to say, okay, I want to see, is there any swelling or anything else that I need to look into? And there's another image called FLAIR. It stands for FLAIR, fluid attenuation inversion recovery. It's the reality. They just want to get us all confused. You know, they want to touch the big box, throw the fancy name, but only it gives us a little bit of swelling. You know, that's really. So I look at it, and as I come up, I try to see when it's swelling. Right there, you can see maybe right there a little bit, but but other than that, nothing major. Right? No. Let's go forward. You got an MRI in February 21st. In 2019, they didn't give you contrast. It's impossible, you know, to tell whether or not there was something like that going on. And the resolution is not as good as the other.
Oh, yeah.
But nonetheless, you can see right there. I'm going to see if I can pull some of the images right now. Where is the flared corona? Maybe this one will tell us a little bit. Oh, is that option? Yeah. So when I look at this, maybe right there, same. I don't think it's that, but not as good scan as the other one. But nonetheless, there was seems to me that it was similar. So from 17 to 19, I don't see any major change. Now let's go to 21.
And this was a brand new MRI machine. They said a week prior to me being there.
It was an okay. It was like it was a usual for MRI. It was not the Ferrari that you needed to do.
Yeah.
One in 17 and in 21 is the Ferrari.
Yes.
But these were the usual. They did the cheap was not as good. But this one is good. The next one that you have is a very nice MRI. So here, these are cuts like this, corona.
Mm-hmm.
Okay.
From the front to the back to the front, but like this, for corona. And here you'll begin to see a little bit of swelling. I show you. Right there, there's a region right there in the middle.
Yeah.
That was near where they took the last one out. Alright? So you also see the swelling right here. And the brain being pushed around. Alright? And I'll show it to you in a different way. Alright? I'm going to pull it out with contrast. And the contrast is going to help us understand this a little bit better. So this one is with contrast. So you see it right now. A lot of white stuff because your veins and your arteries get that stuff. But when you look at this like this, you're about to begin. Right here, there's a little bit of white, and there you go, a little bit more. And this is the area where the surgery was done before. That up until 2019, it was okay. There was nothing going on right there. So now it's coming around, and you see a little in the front, this one right here, and then another one right here. They're connected. I don't think it's another one. It's just, they're like little grapes. They're all connected.
Yeah.
And then this one also, remember back in 2017, I showed you a little one? They got in a little bit, maybe a little bit of smoke, a little bit. And then you see those little dots right there?
Yeah.
There are small little tiny tumors. For whatever reason, your body, I've seen it every now and then, some patients have this predisposition, to develop this. We don't know why. And some patients that had like cancer when they were children and they got radiation, they can develop this, but as far as I remember, we didn't have any of that
No.
stuff.
My great-grandmother also had benign meningioma brain
So
tumors.
that's probably, there's something genetic in you, specific. Nonetheless, this is manageable. I mean, you are only 32. I would not recommend radiation. You need to get this thing out. There's not emerging either, but I think that the way that I do it, you probably think how it works. I like to keep my patients awake. I like to know exactly what they're doing, and I like to push this to try to respect as much as possible.
Yeah.
And I do this nowadays. They have an amazing way of getting patients in and out, and sometimes they can go home the next day in the morning. The only thing that can hold you back is you have a more fever or something.
Yeah.
Because your brain is irritated, but I would continue with the chapter. So I would try to take this big one and those little ones as well. So I always deal with several of them. I think last time they did a good job taking the big ones. The little ones might have been there already. I just don't know.
I think that's what Dr. Friedman was suggesting, and that's why he suggested Gamma Knife. Well, he suggested radiation, and then I found Gamma Knife, and I found out that Duke didn't offer it, so I went to Tufts in Boston. But that's what he was saying, the same thing, because of the location around the artery and optic nerve. He said it was just probably some cells they weren't able to get, some tissue, because of where they were located.
Correct. And I think that I still believe, depending on the pathology, depending on the grade, it turns out that now we're also beginning to understand that some of these tumors, gamma knife, radiation may not be a good thing to do again, because may predispose them to get a little bit more aggressive. That's what I'm saying. Because when did we do the gamma knife?
November 2012.
It is already almost 10 years, so if you need a radiation, you can do it again, but you cannot do some studies on this tumor, more molecular studies.
Yeah, I don't know if the original one that was taken out by Dr. Friedman was ever tested or anything like that. I don't think it was.
I doubt it, because back then we were not doing a lot of the molecular testing, But I think that this time they need to be sequenced. They need to understand what drivers they have. And it would be ideally to get all the little ones right here.
Yeah.
To try to give you a good cleanup. Same deal, keeping your weight, and stuff like that. But I think that would allow me to push this little one right there.
Yep.
To be able to go far back and say, can I take that one out? Is it not going to hurt anything? Or is it going to be okay? Yes or no? Because I was seeing how young and how strong you are. I don't see anything else. I think this is manageable. This is very, very manageable, Josh. So I think that we can definitely, take it. But you definitely need them out. So they are going to begin to irritate your brain more and more. Not emergent, but it's depending on timing, and what you want to do and when you want to do it. I wouldn't wait 6 months. I wouldn't wait 4 months. I'd say in the next 2 weeks to 8 weeks is acceptable, before. Because remember, if you're catching them in a growth period, sometimes they can grow pretty fast. And the more they grow, slightly more challenging.
Yeah.
You know what I mean? So that's why, for me, I think that it would be a good option to get this done sooner rather than later.
Okay.
I think Josh and I are both in the position where we want to get this done as soon as possible.
Yeah, I know last time, 11 years ago, I was not as healthy inside and out. I was drinking alcohol, I was eating processed food, tons of sugar, partying, not sleeping. I was still riding, getting concussions, had no spiritual practice, nothing. And today, completely different. I don't compete, I don't ride anymore. I'm bowling, I'm golfing, I'm working out. So my dad's coming in October for 2 weeks to golf, and I was like, if I can get it done, and then I know the last time I was back on my bike in 5 weeks. So if I can get it done in that time frame, then be able to golf at the end of October, then I'd be stoked on that. But
amazing. I've been watching you. I thank you for a lot of the comments that you make on social media. But I think that you're a turner. I think you're healthier now than you were even when you were younger.
That's what I believe. Yeah.
You look terrific. I think that I know what you're doing. I think that keeping yourself healthy is crucial. I think that you can do a great job. And my role is to, once again, to get rid of these things and then hopefully not having to deal with it for the rest of your life.
Yeah.
If I can take everything that I can see, clean out the whole thing. That would be my goal. Awesome. The issue is whether or not the bone is invaded. Sometimes what I have to do is I have to end up putting a small little plate, believe it or not, of mesh. So if the bone, I don't like it, if it doesn't look healthy to me, I get rid of it.
Yeah.
But remember, those come from the bone and the dura. So sometimes I have to put a little mesh titanium.
Okay.
And then your head, the good thing is that you have a beautiful set of hair, but then it's not a circular, you know what I mean? But it's okay. If you have a flat, just, you think about it a little bit more flat at the top.
I haven't been getting haircuts or anything because I know before I go to have surgery, I'm just going to shave my head. So I didn't do that last time, and I didn't know I had longer hair like this. I just had this long strip. And I was like, then I had to go home and have a friend help me buzz it all off. But I'm not worried about any of that.
I think that you have beautiful hair. I wouldn't cut it. Then you just cut a little strip because then you can put it on the side. You wouldn't be able to tell.
Oh, okay. Yeah, they buzzed it like a strip like that. It starts here and it went all the way back there. And I was like,
I only cut a small little strip, like the size of my little finger, just enough to put the table. We watch it, so we don't cut it anymore. To be honest with you.
Okay, I was gonna ask about that. I know I have 4 titanium screws in there. I was like, is that gonna have to come out, or like how does that all work with this?
I get rid of them and then I put new ones.
Oh, okay.
The new plates, the new screws, all that kind of stuff.
How big will this skull opening have to be?
I think that in this case, Jackie, I'm thinking, I'm going to show you back the images. When you look at something like this, you can see the dimensions. It's about 3 by 3 centimeter lesion. Mm-hmm. So you have to think about an opening of the bone about 5 by 5 centimeters minimum for me to be able to clean up some of the other lesions right here. To be able to get around this and get a nice margin and see all the dura. So that way we maximize the chances of cleaning up a lot of stuff.
Yeah.
Okay. For this, I would also get a magnetic resonance venogram. It's a special study where I look at the veins right here. I need to understand that as well so I can plan the surgery.
Okay.
Because the risk of the surgery, I always have to think about it way ahead of time. Of the risk of the surgery, I want to make sure that you're coming in out first.
Okay.
Yeah, about 5 by 5 centimeters, like more or less. That's what I would imagine.
And
make sure that we get clean up.
So I
all
know
this.
when I came out of the surgery, the original surgery, it was 75 staples and 16 stitches, and it went here all the way like back around there. It was crazy.
So will you not know what type of meningioma this is until you open him up?
Yeah, I usually send it, even after I open them up, I send it to the pathologist, and
Okay.
they tell me a sense of what it is right there. But the final grade, it takes about a week, because
Okay.
they gotta do all kinds of studies.
Yeah, and then they'll also check him for like an F2 or
Yes,
and then
that's absolutely right. You know, we see it, especially with his grandmother's history.
yeah, and then I kind of found some other names of mutations, but I'd rather hear from you like a differential of what you think they might be because it's so watered down if you just try and Google things and I find weird studies and stuff like that. So, are there any
Right
other
now,
mutations?
all the mutations they're all experimental. None of them have been proven to be of any potential therapy significance. But
Okay.
it gives us a sense as to whether or not we should consider radiation,
Okay.
to be honest with you. And in this case, he already had surgery done, a number of years ago. He already got radiation. I would propose that most likely, following the surgery, we're going to have to pause for a few months before making any decisions about anything.
Okay.
You know what I mean?
Yeah.
So that's the way I'm thinking about this, these new sort of drivers that are allowing us to understand these regions a little bit better.
Okay.
And I would probably get a consultation with the genetic team right here to do some blood studies and you to make sure that you don't have certification for some other type of lesions in your body like MS, neurofibromatosis. I don't think so, but nonetheless, we have to be sure.
Okay.
Yeah. Is there any reason for you to believe like that this tumor is atypical or possibly malignant because of how fast it's been growing?
I can tell that if you grow that fast, because even 2 years ago, I don't know if there was something. I like to believe that it's still going to be a lower grade,
Yeah. Yeah.
Because sometimes they keep growing fast. They have a life of their own, and they can still be low grade.
Okay.
I'm hoping that they still. I don't have a reason to believe that this has to go to a higher grade. That's the question.
Yeah.
But we'll find out, of course.
Because he's gotten a lot of blood work done in the last year or so too. He started working with a different doctor. So I mean, would like his white blood cell count be off the same way it would be with like other cancers, or does it not show up in regular blood work?
Yeah, that's right. These are the ones that don't show up in the regular blood work.
Okay.
Yep.
Yeah.
That's why they wrote me off so much when I was 21 because I didn't have any abnormalities in any kind of labs or anything, and they're like, "Oh, you're in shape. You're 21. You're a professional athlete. Like you're fine." And then I hit my head. Oh, wait, you're not fine. There's a massive tumor in your brain. Like who knew?
And because of where this one is located, I know that sometimes seizures can be caused if there are growths in between the two hemispheres of the brain, and I know that sometimes that lasts a bit longer, like throughout the inflammation and stuff after surgery. Is there a strong possibility that he will be prone to having seizures after a growth like this?
There is, and I got to tell you, this is why I also recommend not waiting too long, because the longer we wait, the more irritated the brain gets, the higher the likelihood that he will live with seizures for the rest of his life.
Okay.
What I think that I'm going to recommend is after the surgery is that he continues to see one of my epileptologists.
Okay.
To just keep an eye on him for many years to come, and eventually, if everything is fine, not soon, then we can begin to bring the medication.
Okay.
That's the way I would handle it, to be honest with you.
And speaking of that, so after the recent seizure, the stubborn learning that I need to be on this, Jackie got an emergency script fill that ends tonight. So we just moved to Florida, which you and I meeting, us moving here, you being only an hour and 20 north, it all worked out beautifully. I'm curious, do I need to go get a primary or a local neurologist tomorrow just to get a script, or do I just go to urgent care? Like, how does that work?
This is for the seizure medication?
Yeah, the Keppra. I have one dose left for tonight.
Yeah, no, we should call you a prescription tonight.
Okay.
With your pharmacy. My doctor's going to take care of it.
Okay,
cool. Yeah, we'll take care of it tonight. I'm pretty sure. I'll put an order and you'll pick it up from whatever pharmacy. You can tell my doctor and they'll.
Okay, awesome.
My Jackie will sort it out.
Yeah. Well, thank you. Your Jackie can talk with my Jackie. We'll be good.
My Jackie, she's amazing. She's our nurse. She'll take care of it.
Okay,
Awesome.
great.
Well, sweet.
All right.
You got any other questions?
I don't think so. And we already asked.
Should I, like, do I have any physical restrictions you'd recommend right now? I haven't worked out since May 9th. Just understanding where the mass is, and I've been, like, even though I don't compete in BMX anymore, I still train hard, and I'm lifting heavy, and I was like, let me just golf for now. So I mean,
that. I think that you can definitely golf. I think that you can walk. You can do your walk. I will not get on a bike. I will not be doing any super stressful exercise. I mean, if you want to walk and stuff like that, those are good exercise. Playing.
I've just been doing like yard work and golf and stuff like that.
Yard work is perfect. I wouldn't push it too much. You can still keep yourself active, but I wouldn't do like a heavy duty workout.
Okay.
You know what I mean, or anything like that. But golfing is the perfect if you have a good time. You're out there walking. I like exercises that are long, but steady rather than. Because when you're young, you can push it really high. In an hour, you're out there with a heart rate and whatever amount and stuff. I don't like that. So right now, let your body. It's better to do the golf. It's steady. You can walk around for many hours and feel good about it.
Okay.
Yeah.
All right.
Any other preparations that you would recommend leading up to surgery?
Of course, no aspirin. My team will talk to you about all this, and let's find us a time. Sooner rather than later. They're going to meet priorities. They're going to make, changes to my schedule, so that way we can take care of it.
Oh yeah, if we can get this done in 2 weeks, let's get it done in 2 weeks. Yeah.
We'll work on that right now.
Okay.
I did have one question. I know with the pandemic and all that, Jackie and I, we're engaged, but we're not married yet. Is she going to be able to come with me, or like how does that work?
She'll be able to come. She'll be only one person because that's how we kept the hospital really safe.
Okay.
Only one person. Even though the whole country is going crazy, Mayo Clinic will remain extraordinarily safe.
Okay.
The hospital, we've been able to only one person and it has to be the same person.
Okay.
So she can even stay the night with you.
Okay, awesome. Okay. And I just got my second round of the Moderna vaccination today, so.
And you too, Jackie, you got your vaccination?
Oh, I've been vaccinated since February, so yeah, I'm great, yeah.
Jackie got first dibs being in sports medicine.
Yeah, so the first responder category, so.
I like it.
Yeah.
Hey, Jackie, what's that? Show me the tattoo. What is that?
Oh, it's a lot of flowers and a big Hamza hand back here, and then a big old like cup and a wave. Like I've got all sorts of stuff going on.
That hurts, doesn't it?
So much, yeah. it was not fun.
Josh, what do you have?
Oh, I got a memorial piece for my brother. It's so he loved Deadpool and he was a goalie he was a hockey goalie. And so we made up our own Marvel character. He also loved elephants, so we made like it's kind of hard to see because it's so wide. But we made a hybrid elephant Deadpool Marvel goalie character.
Yeah.
And that goes into I have like an Alice in Wonderland piece and like this logo I have, this peace brain. I have that embedded in here and some other words and stuff. And
so. I was just thinking because my daughter, my oldest one, is 22, and I've been trying to figure out. She wants to get a tattoo, and I've been thinking about what can we do.
Yeah.
I was 27 when I got my first tattoo.
I never gotten one, but I know she loves the art, and she's got a design for me, but we'll see. Maybe in a future.
Yeah. That'd be great to get one with her. That'd be awesome.
Last thing too, I'm filming for my own film. I saw yours. It was beautiful. Loved it. I remember you talking to me about it happening when we met. And I wanted to see, is there any restrictions on us filming, even though it's just us, but like bringing in like a GoPro or camera or anything like that?
I don't think so. Whatever you want to do. I think that's you mean even the surgery and stuff?
Oh, I mean, if I can, like any footage I can get, I would love to get whatever I can.
It's a little more tricky about that, but if you want to, what I can do is I can ask my media, the Mayo professionally, to see if they are interested in helping us filming you going through this process right here, you and Jackie. And
that would be awesome.
They make that film available to you.
Oh, that'd be amazing.
They like to have, because of the patient confidentiality, they like to make sure that the shots are the way they like.
Yeah.
Okay. Yeah, we're finally 11 years later putting together a documentary film about my story of riding X Games with a massive brain tumor and almost dying somehow not, and then here I am today, and just even our dynamic of how we connected, and then now we're back here and all that. So
the two of you guys, I watched you. I told you that page. All the stuff that you guys are doing is beautiful. And I think that I recently got approached, believe it or not, by a foundation from Spain. It's called Brains Get Famous, and one of the founders is the grandson of Marlon Brando. Even though you guys are young, you guys know who Marlon Brando was, the godfather, got multiple Academy Awards.
Yeah.
So they are doing amazing work, and the woman who funded was also a brain tumor survivor.
Oh wow.
She's amazing. So I think that what you're doing and making sure that people understand what it's like to live with brain tumors, and that you can still have a meaningful life full of energy and positivism, as I can see you and Jackie doing it. It's important.
Yeah.
Because you can either let the disease control you, or you can make an effort to say, I am going to control my life. Not the disease so much, because you can tell we have no control of it,
Yep.
but your life in some way.
Yeah,
Right,
for sure.
yeah.
Yeah, that's awesome.
Good. All right. So you have my cell as well. I think I gave it to you last time, but now I'm going to put it right there in the chat.
Okay.
I just for anything you need. But Diogo Garcia, right here, right next to me, Dr. Garcia is going to take good care of you.
All right, awesome. Well, it was good seeing you. I appreciate your time.
Thank you so much.
Thank you, guys. Have a good night, okay?
All right, thanks. You too.
Take care.
Bye.
Bye.